Well, we've had lots of feedback on calls for marijuana to be legalised for medical use this morning. Sharon Wagner wrote on Facebook, "Totally agree, 200%. I'm battling my second lot of breast cancer at the moment and have done a lot of research on how cannabis oil is helping so many people. Bring it on." Kate Devison said, "We won't allow the use of marijuana for medical applications, but doctors can prescribe opiates as painkillers and amphetamines to kids with ADHD. Does this make sense to anyone else?" Cherry O'Connell says medical marijuana has changed her daughter Tara's life. Check this out.
Tara was having 65 on a good day of seizures and up to 500 on a really bad day. Now, since being on the medical cannabis, we're now approaching 16 months without any seizures at all.
Well, it's helped there, hasn't it? And others, though, question the legality and the morality of using the drug at all. For more, we're joined by Dr. Alex Wodak, the Director of the Alcohol and Drug Service at St Vincent's Hospital in Sydney. Doctor, good morning to you.
Good morning.
Let's sort some facts from fiction here. First of all, does marijuana make a big difference in the treatment of some patients?
Yes, it does, especially where the conventional drugs haven't worked.
In what way?
Well, it reduces or sometimes stops the severe nausea and vomiting that can develop after cancer chemotherapy. It reduces chronic severe pain, particularly if that's due to nerve damage rather than tissue damage. Improves appetite in people who've lost a hell of a lot of weight due to advanced cancer and AIDS, and reduces muscle stiffness in multiple sclerosis. These are all very distressing symptoms.
Very distressing. We've heard also about the negative impacts of marijuana on health. How do you balance up what's positive and what's negative here?
Good question. And really the concerns about recreational cannabis, which I think are willfully exaggerated, but anyway, they really apply to a black market drug. And when a drug is used medicinally, where the drug is regulated and is the dose and the time period is all controlled by the doctor and the whole system, it's a different kettle of fish. And studies of medicinal cannabis show that the side effects are insignificant.
So what is the difference? So just describe that in more detail if you can. The essential differences between the way it's produced, the way that people consume it, between recreational and medicinal.
Correct. Well, we have a drug which would be produced under controlled conditions, where the drug that's used in 2014 would be the same drug that would be produced in 2024, and where the doctor would prescribe it from August the 1st till August the 31st for a finite period. In the black market, you don't know what's happening on. It's like the difference between regulated alcohol and Al Capone's alcohol. That's the difference.
That's a good analogy. From your perspective, and it always astounds me that we have very advanced medical professionals, practitioners saying we want something but we can't get it, and we know that it's good, and we've made the decision based on expertise, and you have others in the community saying no. Where do you think it should be? Where should we be at right now?
Well, first step, I think, is to take the politics out of it. The politicians don't decide whether penicillin's to be regulated or not, or how it's to be regulated, and they shouldn't be, frankly, they shouldn't be deciding on medicinal cannabis. It should be left to experts. We have a very good healthcare system in Australia. We regulate medicines well, and we should hand this over to the experts. Leave it to them.
I've got no problem with it. I'm not sure, and as you say, there are elements of the community that do. And they may be in smaller number. I guess it's hard to gauge. But what would you say to those people in the community that say, well, marijuana is illegal, so how can it possibly be prescribed?
Well, we use many drugs in medicine whose recreational use is prohibited, but they're very effective medicines. Morphine, cocaine, amphetamines, ketamine, these are all drugs that are used recreationally, that use is banned, and they're very helpful in medicine today.
The way forward, finally?
Well, the TGA has to approve this so that states and territories can use it, and that costs a lot of money, and politicians have to get out of the way.
All right. Great to talk to you today. Great insight.